Beauty centre operators and non-doctors found to be practicing aesthetic medicine can be fined up to 50,000 ringgit or jail for up to 2 years once the amendments to the Medical Amendment Act 2012 and its regulations come into operation before year-end. Deputy Health Director General Datuk Dr. S. Jaya Indran says that the ministry is in its final stage of drafting the regulations following the amendments passed in Parliament in June last year.
They can be hauled up by MMC if they portray that they are a doctor, or they make a person believe that they're doing things that a doctor under the Aesthetic Medicine Act is doing. So if you give the assumption that you're behaving like a doctor, then they can take action.
He said this during a press conference at the second Malaysia-Singapore Conference of Aesthetic Medicine in Kuala Lumpur on Saturday. Dr. Jaya Indran was replying to a question if the ministry is taking any action to address gaps in the law that did not penalise beauty centre owners who conduct invasive cosmetic procedures. Recently, the Star reported that consumer bodies urged that they and untrained doctors be criminalised for carrying out the procedures. The uproar ensued following the death of Jane Lee Mei Juan, who underwent a breast enlargement cosmetic surgery but died due to complications. Asked if beauty centres can promote cosmetic procedure packages for doctors, Dr. Jayad Indran says doctors could breach the professional code of practice if they tie up with the beauty centres.
Because you should not be canvassing and you should not be having agents to be bringing patients to you.
Recently, guidelines on aesthetic medical practice was introduced, and doctors who carry out the procedures that they did not have the credential to do so will be hauled up by the MMC for breach of professional conduct of practice.